Assalamu alaikum warahmatullahi wabarakatuh. Welcome back to my channel. This is Dr. Sana. Today we are going to discuss about postpartum bleeding or Lochia. The postpartum bleeding or the bleeding after childbirth is called Lochia. It is normal part of recovery as the uterus sheds blood, mucus and tissue after delivery. So, what is normal in postpartum bleeding? So, let's look into why postpartum bleeding occurs or why it is happening. Postpartum bleeding occurs because the mom's body is healing after childbirth and the uterus is returning to its pre-pregnancy state. The main reasons postpartum bleeding occurs are: 1. Placenta detaches from the uterine wall. During the time of pregnancy, the wall of the uterus, internal wall, the innermost wall of the uterus grows many capillaries. Inner wall of the uterus or endometrium thickens and forms a capillary blood or small blood vessels becomes a bed-like structure for the baby. The baby gets the nutrition through the umbilical cord and which is attached to the placenta, and that placenta is attached to the inner wall of the uterus. Okay. This provides the nutrition and the oxygen, all the which is required for the growth and functioning of the little baby inside the uterus for the 9 months. During the pregnancy, the placenta is attached to the uterine wall. Once the baby is born, the placenta separates from the inner wall of the uterus and leaving a large wound inside the uterus or the wall of the uterus. Bleeding occurs as this area heals. Number 2 is the uterus sheds tissues and blood. The uterus no longer needs the thick lining that supports the pregnancy. Okay. The blood, mucus and the remaining tissues are expelled through vagina as lochia. Number 3, third point is uterus contracts. The uterine contractions helps to compress the blood vessels where the placenta was attached. These contractions reduces the bleeding and helps uterus shrink back to its normal state. So next point is when bleeding is excessive. Heavy bleeding can occur if the uterus does not contract well after the delivery, or we call it as uterine atony. Pieces of placenta remain in the uterus, or there is a tear in the cervix, vagina, or uterus, or there is a blood clotting problem. Excessive bleeding after childbirth is called postpartum hemorrhage and requires immediate medical attention. How long this bleeding is normal? Normal postpartum bleeding, Lochia, usually starts bright red and heavier for few days. Gradually it becomes lighter, changes the color, lasts about 4 to 6 weeks, though some women may have light spotting for longer. So, the first few days, it is called Lochia rubra. It is bright red in color, similar to the heavy menstrual period. Okay. Small clots may occur at this time, usually last 3 to 4 days. From 4 to 10 days, it is called Lochia serosa. It is pinkish brown discharge, lighter flow. Then up to 6 weeks, it is called Lochia alba. Yellowish white discharge gradually decreases and stops. Now let's look into when is the postpartum bleeding a concern. Seek medical attention promptly if you have soaking a pad in an hour or less. Large clots occur larger than a golf ball. If that is occurring, you should seek a medical attention. Bleeding that suddenly become much heavier after slowing down. You feel dizzy, fainting or rapid heartbeat, severe abdominal pain, or you have fever 104 degree Fahrenheit or higher, foul smelling discharge occurs, then you should seek a medical attention immediately. Heavy postpartum bleeding can be sign of postpartum hemorrhage which requires immediate medical care. So how long it normally lasts? Most women have some bleeding or discharge for 4 to 6 weeks, though the amount varies from person to person. Okay. Now next question. will it happen in vaginal delivery and C-section, both cases? Postpartum bleeding occurs after both vaginal delivery and C-section, but there are some differences. After vaginal delivery, bleeding is often heavier during the first few days. Bright red bleeding gradually changes into pink, brown, and then yellow white over several weeks. Bleeding typically lasts 4 to 6 weeks, though it can vary. But in after C-section delivery, you will still have postpartum bleeding because the uterus must shed tissues and heal regardless of how the baby was born or delivered. Bleeding is often somewhat lighter than after the vaginal delivery, but not always. Okay, it can also last several weeks. So seek medical attention if you soak through a pad in an hour or less, you pass large clots larger than a golf ball, or you develop fever, chills, foul smelling discharge, severe abdominal pain, dizziness, or fainting. So that's all about today's video. We are stopping over here and we will come back with another topic in the next video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.